Hi, this is Dr. Cliff Gronseth coming to you with a Dr. Cliff's Riffs. I have been out of commission for a little while, but I'm back and I'm going to try to stay a little bit more on schedule. Every other week, I'm going to try to do a little educational YouTube live video for those that are interested in general healthcare trends, current advances. Today, we're going to be talking about regenerative medicine, PRP, and stem cells versus steroids. As you know, the steroids have a bad name to some people. However, there are some use cases for steroids that are still applicable, and we'll go over that today. I'm going to focus mainly on knee osteoarthritis and knee pain, and we will use that as a use case for other types of injections. So the idea of regenerative medicine and corticosteroids, which are another name for the steroids that we inject into your body versus the steroids that make you grow or build big muscles. The corticosteroids are very strong anti-inflammatory medications. They basically affect the genetics of the cell so that it produces less inflammatory markers. So the steroids actually work on the cell system rather than the regenerative medicine, the PRP, which actually tries to grow cells. The difference of steroids and something like aspirin or Motrin, Aleve, anti-inflammatories that you might swallow is that the injectable corticosteroids provide some a little bit delayed response, but they provide a longer lasting benefit than the pills that you swallow, which affect the cascade system for inflammation. So the idea is that the steroids work fairly quickly, not as quickly as ibuprofen or another anti-inflammatory medication, but usually within a few days, up to a week, they should start to kick in. They affect the cell metabolism, and then they suppress the inflammation in a body part, for example, a swollen knee. And the PRP, or the stem cells, work a little bit differently. They are basically stimulants, almost like fertilizer on a patch of dry grass to try to stimulate new growth, new cells, and the PRP and stem cells are thought to inhibit or slow down the degradation of a joint. Now, the idea of steroids versus PRP, which is basically platelets that are spun out of the body, or stem cells, which are drawn out of the bone marrow typically, or perhaps fat cells, but we use bone marrow aspirate. The idea of the platelets and the stem cells stimulating the natural endogenous or the natural cells that are inside the joint that tend to be quite sleepy, fairly dormant, and kind of awakens them with the idea that it will promote natural healing, quote unquote. Now, the process of getting the PRP or the stem cells is oftentimes through a machine. We use a cell counter, not a centrifuge, so we can be very specific in how we harvest the cells and how concentrated the cells and the platelets are in our solution that we inject, because the different types of final product or solution that we inject will have an effect on whether or not the body will cause significant inflammation from the injection or perhaps dampen the inflammation. The centrifuge model tends to be an all or none. That type of product isn't able to uniquely separate out the white cells, which are typically the most inflammatory causing cells in the system. So we're able to get rid of the white cells if indicated for a joint. You want to minimize the inflammation inside of a joint, but you may want white cells if you're injecting a tendon, because then you want inflammation and you want the tendon to become inflamed and heal that way. But for the joints, you really want to minimize inflammation because the inflammatory cells inside of a joint can degrade a joint. So those are the two processes: the pre-made corticosteroids, which come pre-packaged. There's multiple types of steroids. They all are more or less equivalent. The formulary or how they're delivered is slightly different. Some are like a colloid, almost like a milk of suspended particles, and others are clear solution with no particulates. Regardless of which product you use, the steroids tend to work the same. They work on the genetics of the inflammatory cells, suppressing the inflammation over the course of a few days. The steroids work very quickly, and unlike PRP, which may take weeks to notice an effect, versus the steroids, which work within 1 week. Motrin, aspirin may work within an hour, but it doesn't last. Same with the steroid concept. It can start working within a few days, and it typically can last up to a few months, and then the effect starts to wear off. The platelets tend to be a little bit more slow in creating a response, and they last a little longer for the response. So if you're going on a trip and you've got an acute painful joint situation, you can try the Motrin for sure. You can also try steroids, because that will likely calm down the symptoms quicker. And then if you want, when you come back, if you're interested in trying to get some natural healing, you can use platelets or stem cells. Now, with regards to platelets or stem cells are quite expensive. They're a little bit more difficult to harvest and isolate out. The data on stem cells is still lacking for many, many studies. The only proven efficacy for stem cells right now has been bone marrow transplants, which they've been doing for decades. But as far as the efficacy of stem cells versus platelets, the results are mixed. Platelets have a little bit more research behind them. There are oftentimes small studies. The large aggregate studies are still kind of in the works. They're still working on it. But there have been both anecdotal responses from our clinic and, of course, from other clinics to suggest that they may help in some conditions. Now, for arthritis and platelet-rich plasma, if you have a mild arthritis, if you have a little narrowing of the cartilage in the joint, then the PRP, works best, because that will help stimulate some endogenous growth. If you have an end-stage joint like this one, where there's really no cartilage left, there's not much hope for that hip, regardless of what you put in there, that is not going to improve with regenerative medicine products such as PRP or stem cells or magic pixie dust. The only thing that's going to probably help that hip is getting a surgeon to give you a new one. This hip, however, may benefit from an injection of biologics such as PRP to see if that can salvage the joint. If the situation requires an immediate response because of severe pain, then an injection of steroids may be indicated. It may be an acute situation where it can calm things down quickly, but you don't want to repeatedly inject corticosteroids into the joint, because it can soften the cartilage and accelerate arthritis over time. So that's where the kind of the negative image of steroids has developed. Too many injections into a joint has accelerated arthritis and then caused the patient to require a hip joint. Now, you have to be realistic about the responses. You're not going to get a brand new knee out of platelets or stem cells, regardless of what you inject into the knee. But the overall quality of life may improve with the platelets, sometimes with the steroids, but that again, that lasts for just a few months, and the platelets can stack over time and provide some benefit for even a year. Sometimes we'll do repeated platelet-rich plasma injections into a joint just to keep stimulating, depending on the responses. There's no hard and fast rule about how many injections and the timing. There's a lot of marketing that goes on in these biologic regenerative medicine world, but the idea is the steroids can provide some immediate benefit, but limited to likely a few months of relief. The platelet-rich plasma can have a slower onset, provide a longer benefit, and can be repeated multiple times without significant harm. If done correctly, we always use ultrasound guidance. We make sure that it is a very clean and effective procedure so that this type of injection and this type of product, this biologics, can hopefully have its maximum benefit. At Spine West, we will dial in the exact combination for what your body would likely need, whether it's white cell or leukocyte rich or leukocyte poor injectate, just with the idea that eventually you'll get to enjoy life better, that your quality of life it will overall enhance, and you can certainly enjoy the outdoors with more joy in your life. Hope that was helpful. If you have any questions, just give us a call, make an appointment, and we can explain more. Have a great time. We'll see you next time.